months before the coronavirus first emerged as a deadly disease in Wuhan, China, Dr. Theresa Tam's public health agency was busy patting itself on the back about their own preparedness while they unknowingly sat on millions of expired medical masks and gowns. The people who are absolutely the most inept at their jobs are almost always the ones who think they are just really nailing it, just really doing a bang-up job. It's called the Dunning-Kruger effect. Look at this. The Dunning-Kruger effect is a type of cognitive bias in which people believe that they are smarter and more capable than they really are. Essentially, low-ability people do not possess the skills needed to recognize their own incompetence. The combination of poor self-awareness and low cognitive ability leads them to overestimate their own capabilities. And it seems that the Dunning-Kruger effect is especially evident in government. In a normal workplace, that sort of lack of self-awareness from the worst of employees, well, it's annoying for the people who have to work with them, but it's not normally life-threatening. However, that's not so when it's coming out of the bureaucracy created to prepare Canada for a coming pandemic. Blacklock's reporter has the story today sitting behind their paywall. The Public Health Agency, in a 2019 internal memo, boasted it was fully prepared for a pandemic after spending millions stocking federal warehouses. The memo was dated last September 16th. 3 months before the coronavirus was first detected in Wuhan, China. The agency, in its briefing note, National Emergency Strategic Stockpile, said it was so prepared all rush orders for masks and other supplies could be filled in a day. The target timeline to deploy assets is within 24 hours, wrote staff. The censored 5-page report claimed the agency was alert to, quote, pandemic preparedness, end quote, with adequate stocks of ventilators and, quote, enhanced personal protective equipment, end quote, including masks, gloves, and disposable gowns. The agency had spent $79 million to stock warehouses, it said. Management in memos acknowledged they were to have 4 months' supply of goods on hand. Plans are required to allow for a consistent 16-week supply, i.e. 2 pandemic waves, wrote staff. Records indicate instead of a 4-month supply of masks, the agency had only 65,000 on hand when the World Health Organization declared a global pandemic March 11th. Health Minister Patricia Hajdu, in June 26 testimony at the Senate Social Affairs Committee, blamed provinces for failing to stock up. Now, God only knows what the Public Health Agency really spent that nearly $80 million in cash on, because just look at this in the CBC of all places. The Government of Canada threw out 2 million N95 masks and 440,000 medical gloves when it shut down an emergency stockpile warehouse in Regina. A spokesperson for the Public Health Agency of Canada, which oversees the stockpile, said in an email that the masks and gloves had been purchased in 2009 and had passed the limit of 5 years for their use as recommended by the manufacturer. The masks expired in 2014. Critics have wondered why Ottawa let its stockpile of crucial medical equipment sit expired for 5 years. And also remember, the Public Health Agency timeline was to deploy assets within 24 hours, 1 day, except it wasn't anywhere near that, and hospitals end up rationing PPE, at least in the early days of the pandemic. Look at this in the Globe and Mail. Some Canadian hospitals are limiting frontline staff to 1 or 2 disposable masks a day and asking the public for donations of protective gear as they prepare their wards to be flooded with patients made severely ill by the new coronavirus. The rationing of paper surgical masks is happening despite Ottawa and the provinces, promising that more personal protective equipment is on the way. However, government officials have not said exactly when the fresh masks, gloves, gowns, and other gear will arrive, leaving some physician leaders and hospital administrators in Toronto to craft their own mask conservation policies and launch donation drives for equipment. Thank God the coronavirus wasn't the plague we all worried it might become, because the Wuhan flu is as effective at killing the young and healthy as the Public Health Agency is at doing its job of preparing for a pandemic. For Rebel News, I'm Sheila Gunn-Reid. Dr. Theresa Tam's constant flip-flopping and mixed messaging has caused the public to lose trust in our health officials. But the mainstream media, they don't want us to look critically at her and the government for their mishandling of the pandemic. But we are going to. And if we're going to need your help. To help us in our ongoing coverage of the pandemic, please go to helprebelnews.com and make a donation today.